Welcome to the HealthiHer podcast. Your host, Dr. Amy Brenner, is a board-certified OBGYN with additional certifications in functional and integrative medicine. This podcast is meant to help women find reliable, relevant information to help them feel better, look better, and live better. Here you will hear in-depth information about hormones, sexual medicine, aesthetics, cosmetic gynecology, and functional medicine.
Hey, podcast listeners. Welcome back to another episode of HealthiHer. And today we're going to talk about something really sexy. I have somebody very special. Her name is Dr. Carolyn DeLucia, and she is a board-certified OBGYN and the author of a great book called Ultimate Intimacy, The Revolutionary Science of Female Sexual Health. So welcome, Carolyn.
Thank you so much, Amy. It's such an honor to be with you today. I just want to say that the mission is what I've been working on for the past several years, just to get the word out that women are done suffering in silence, and being an active participant in intimacy and wanting to have sex is not taboo. It's a natural human need. And that's what I want to talk about.
Well, I just love your book. After you and I met at the cosmetic gynecology course this past Florida, you told me about your book. I came home and bought it on Amazon, and it's not often where I read a book and I think I agree with every single word that's in that book. And it's so informative, and it's also really funny. So you do a great job. So how did you ever get into being a sexual wellness physician and even writing the book?
Well, it was a little bit of a journey, and it really starts with being an absolute traditional OBGYN for many, many years. And
how long did you do that for? The regular OBGYN?
I delivered babies till 2001. So total traditional OBGYN for about 20 years.
Oh, yeah, and you did it for a while.
Yeah, I delivered over 4,000 babies. And then my daughter was 10. I was missing events, and she was becoming very vocal about me not being there. And at 10, my daughter, who is now 30, turned to me and said, "Mommy, if you are not in that audience, I am not getting up on that stage to do my piano recital." And I had a woman in labor. She was 8 centimeters dilated. Of course, I had coverage, but I said, I took out my superwoman cape. I'm going to do it all. I'm going to deliver this baby, and I'm going to be there within those 5 minutes. And I was not. I was not in that audience, and my daughter did not go on stage.
I read that in the book. That hurt my heart, because
right?
Really any traditional OBGYN has been there, done that, and have missed lots of things.
And sacrificed my own child for my career and my patient, putting my patient before my own child, which at that time was a big pull in my heart, because I love my patients, and of course I love my daughters. So I was pulled, and I decided I needed to stop that temptation. And I dropped obstetrics and focused on GYN. And in doing so, opened up a med spa because my income was dropping, and my husband at the time was concerned financially. And I started the med spa. And having an understanding of lasers and injectables like Botox and fillers, when the first laser for vaginal treatment came to the United States in the Northeast, they came to me and offered me to try this new device. And at first, this real handsome guy walks in and tells me about this laser that's going to rejuvenate the vagina. And I kicked him out of my office. I said, get out of here. I was hitting him with a broom, get out, scat. And then he humbled himself and came back in and said, please listen. I said, all right. And he told me it would help urinary incontinence. And that certainly struck a chord. So I said, what do you have to tell? All right, I'm going to listen. And I did get that first laser in the Northeast and was able to begin the journey in this field of attempting to use non-invasive procedures to help women maintain their intimate health, be able to be comfortable, active, and enjoy sex. So that's how I got into it. And as the years have gone on, I've discovered so many more treatments. The whole specialty, so to speak, is exploding. And I'm very excited to share that there are new and better devices and treatments coming out every minute. I'm doing 2 studies right now on 2 different devices. One of them, I have to tell you, is absolutely astonishing, is my word for this device.
Are you allowed to share, or do you still have a...
I am, because it just got released for women. It's been released for men for the past 6 months or so. And Amy, it's called Duo, D-U-O, by Alma Lasers.
You know what's interesting is the rep. You and I had this appointment set up, and a rep came literally yesterday, and told me and brought up your name. It's a shockwave device.
Yes. It's a completely painless shockwave device that is used externally only. And the results have been off the chart. Almost every single woman has had increased sensitivity, being able to have much better orgasms or reaching orgasm much easier. And they've had improved lubrication, which is an endpoint I was not expecting at all, because I was treating externally. I was treating mainly the clitoris, and to have increased vaginal lubrication is an added bonus. And the reason for that is the level of penetration of this particular shockwave therapy. Fascinating, and just so simple, so comfortable. You don't even feel like anything is happening.
So some people who are listening might not even know what shockwave is. I actually did a podcast with another colleague of mine called Shock Your Penis Back to Health. And it was a shockwave for men. But if you haven't listened to that podcast, you can go back and listen to that as a treatment for erectile dysfunction. But if you haven't, could you just explain to people what shockwave is and how it works?
I certainly can.
Because this isn't in your book, because this is new.
No. Exactly. So shockwave, there's 2 different types. There's radial shockwave therapy that's been around in the U.S. For many years for treatment of muscle discomfort and muscle spasms. It's been used in physical therapy quite extensively, and that's radial shockwave. The depth of penetration is no more than 1 centimeter, half an inch, even less. And what it does is the energy is focused mostly on the surface and then radiates out, and at a very shallow depth. It is somewhat uncomfortable. It'll feel a little bit like a snapping rubber band. And for treatment in men, it will need to numb the penile shaft before the treatment. And each treatment using that type of shockwave is approximately 10 minutes. Most men do 6 treatments. Great results. But that's that. Then there's this new type of shockwave, as far as in sexual medicine. It's been around since 1970. It's been used to break up kidney stones, was the first way it came to the medical field. But by lowering that intensity, it's called low intensity focused extracorporeal shockwave therapy. So it's a mouthful, but what it does is it gives gentle shockwave, and this is a ice cream cone. So it comes out wide and then focuses the energy, and the level of penetration into the tissue is up to 13 centimeters or almost 7 inches.
Oh, wow.
And what happens is that the body's response to any of these shock waves is something called bubbles or sound cavitation. Bubbles are a change in phase of gases in our body. So we all have water, and it can turn to gas and go back to water. And when shockwave hits our tissues, the water is turned into a gas, and as it tries to move forward, it gets reversed right back into water. So it doesn't really travel, but that change in state is enough to cause a tissue reaction that will cause healing in that area, which brings new blood vessels, and with that, repair to the tissue. So the main result of shockwave is increased blood flow.
Right. Well, you're going to have to write a second edition of your book because this isn't even in your book. So
exactly. The field is constantly evolving, which is so exciting.
So I love some of the words you use in your book are just so funny. So I think the title of one of your chapters is "Vagina is the New Kale." And I just was like, that is so funny because, and then you go on to talk about, all the treatments that we have in our arsenal to treat the vagina and, or treat sexual issues in women. So, you had mentioned O-shot, hormones, carboxytherapy, lasers, RF, like electromagnetic radiation. So, if we have time, I'd love to just kind of highlight a little bit about all those treatments because there's just so many options for women.
Yes.
And then how do you pick? And I love that you address combination therapies. So
yes. And the book is short and quick. I did that on purpose because we are all so busy. And there are tons of books out there on women's health that are so long and laborious that active women like us don't have time to spend reading that kind of a novel, so to speak. So I really quickly touch upon them. And I like to think of the book as a tool for women to get a quick idea and then go to their doctor to discuss further. But
you could read it in a bathtub. I mean, last night I
right.
just reread it so I could have it fresh on my mind. And it's a great, easy read. And like I said, just really funny. Like I literally laughed out loud when you said that, people in the past don't talk about this. And if women don't take care of their vagina, it can literally feel like taking one of those like metal hairbrushes and putting that up your vagina. And that's what it feels like. I'm like, I haven't heard it described like that, but that sounds about right.
It sure does, unfortunately. So what can we do about it? The O-shot. The O-shot is platelet-rich plasma, which is the portion of our blood that helps us heal ourselves. And it's literally, we draw blood from your arm like you're having a blood test. We process the blood in FDA-approved kits and centrifuges specifically created to isolate and concentrate that portion of our blood that helps us heal ourselves. And then it's re-injected to where we need it. It's been used extensively in sports medicine, in joints and in plantars fasciitis by the podiatrist. And now, for the past 10 years at least, it's been used in sexual medicine for men and women to improve sexual function. So by painlessly, and I mean painlessly, injecting it into the clitoris and into the G-spot zone, the front wall of the vagina, women are experiencing improved orgasm intensity and sensation. And men as well have seen erectile improvement by injecting the penis painlessly once again. The electromagnetic energy or high intensity
So I have a couple
electromagnetic
questions about the O shot.
So, go ahead.
Because obviously, as the name implies, it was originally developed to make O shot better, but I use it in my practice for other things, and I'm sure you do as well.
Yes.
So I use it for women that have incontinence or bladder issues. I also use it for dryness, and I even use it of injecting it on the vulva for lichen sclerosis. Are you doing the same?
Oh, very much so. Absolutely. And it brings back a lichen sclerosis being a condition that's just absolutely devastating for anyone inflicted. It helps to return that tissue back to looking pink and healthy versus a white, chapped, irritated, inflamed, and painful situation versus constantly being on steroid ointments. So it's a wonderful natural addition and perhaps sole treatment. I've had patients completely reverse their lichen and they come every 6 weeks and then once every 6 months to once a year for maintenance, and they don't need the steroid creams anymore.
Same.
So
I found that treatment's actually 100% effective for lichen sclerosis. I've never had anybody that didn't respond. Versus the O shot, maybe you could talk about your results, because I found that isn't 100% when we're dealing with orgasms. When we're dealing with incontinence or dryness, I feel like it's a different thing. But I just wanted to know what you thought your results were of doing the O shot to make orgasms better.
I find anywhere between 80 and 90% success, unless they've never, ever, ever had an orgasm. If someone has never, ever experienced an orgasm, then that result is around 50%. But the 80 to 90 is truly a reflection of the concentration and the value of the PRP. I find that there are different concentrations. You can have something called a single spin or a double spin system centrifugally. And when you are not using a double spin, your success rates will be lower and you might need to do 2 procedures versus 1. So the quality of the PRP makes a difference in the O shot. I find that very, very critically. And in using a high quality PRP that's concentrated 4 to 8 times, I get much better results and I'm much closer to 90-95% success and without repeating.
Yeah, I think it really makes a difference of what centrifuge you're using or what instruments you're using to process the PRP, because if somebody's using a less expensive one, you're just not going to get results. And you probably, I know you do a lot of hormone therapy and testosterone for women. So I also think that that's why maybe somebody like yourself and myself, that maybe we get 90 plus results, because most of our patients are hormonally optimized versus maybe somebody that's doesn't do hormone therapy. I think that plays a role. Do you?
I do, but I will say that I have been on testosterone myself. When I don't have my O shot once a year, I feel the difference. The testosterone alone for me, for sensation, is not enough. When it comes to libido, I wouldn't do without it.
Same.
But I do feel that for sensation, testosterone is not quite as effective as the O shot, and that the combo is the best answer.
Yeah, I mean, that's how I actually looked into getting trained to do the O shot is I had been doing hormones for many, many years, and that helps with libido, but women were saying I still have an issue with orgasm. And at
Hmm.
this was, I don't know, 6, 7, 8 years ago. I'm like, what am I going to do about it? And started researching and heard about this O shot. It wasn't as widely known at the time.
Hmm.
And that was our solution to what are we going to do for these women who have great libido, but still take forever, which in your book, I thought that's so funny. If you say, as you get older, it can take a while, and you're thinking like,
Hmm.
oh, this is taking forever. Like you start thinking about what I'm going to make for dinner, and this is embarrassing. He's probably wondering what's taking so long, and
Right.
I'm like, every woman can relate to that. So,
That's right.
so it's so funny. All right. What else do you have in your tool bag to help broken vaginas, as you refer to?
We have the lasers. So lasers can be CO2 lasers. They can be erbium lasers. They can be new steady state lasers, which are diode lasers that are coming into the country now. And these products will treat the vagina full length internally, as well as externally for skin tightening. And inside the vagina will cause new growth of collagen and blood vessels, which will help with a sense of tightness and increased sensation, as well as lubrication. And urinary continence is improved by support around the bladder. I like to think of the vagina pre-baby as a cylinder, and after a baby, it can almost turn into a square where the walls are falling in from all four sides. The top or the ceiling is our bladder, and then the side walls will cause a sense of laxity, and the back wall is our rectum. So after a baby, any one or all of these walls can get weakened and need to be supported. So a laser is still the gold standard in returning that tissue to its quickest and best function. The radio frequency, on the other hand, is another form of energy. It came to the forefront because it was a little bit less expensive. Lasers are very, very expensive. So it's a little bit less expensive for the physician, so less expensive for the patient. And it's not quite as invasive. It does take maybe longer to take effect and to work. But radio frequency can be a very long procedure. The first devices to market were approximately 20 to 30 minutes of treatment with what looked like a toothbrush going in and out of the vagina. I can say that there are newer devices coming to the market that are 8 minutes intravaginally, and that will revolutionize the market because it's very quick and efficient, great results. Patients love the feeling. It's a comfortable procedure, and there's zero downtime. Lasers, typically, there's no penetrating intercourse for about 3 days post-treatment. That's not devastating, but it's still something to keep in mind, especially if you're not sharing it with your partner. And with the radio frequency, there's zero downtime. So there's immediate return to function without needing to divulge what you may be doing. So that's very popular as well. And HiFem is high intensity electromagnetic energy, which is a Tesla magnet that we sit on in the office, fully clothed. And it tightens every pelvic floor muscle and rebuilds the whole infrastructure of our pelvis. And in doing so, helps to support all the organs. So helps to lift the bladder and the rectum. And by increasing that tone, women have a 75% cure to improvement of their urinary incontinence, and it's good for men as well, and a improved sexual function, where the women have seen improved orgasmic function, arousal, sensation, the whole gamut by at least 50% by just sitting on the chair 6 times. We just completed that study on sexual function in the chair.
Yeah, it's just so great that there are just so many options and so many choices versus, I think patients, which is just why I love your book and want to help get the word out about your book. So
Thank
people,
you.
people know, women know that there are options, because I don't think women understand that when you go through menopause and your hormones decline, that literally your vagina is going to shrivel up. No,
Yes.
I don't, or the medical term has become atrophic, and it can feel like, I've usually described it feels like razors in the vagina, but I really love the putting the metal hairbrush in your vagina. I think I might change to that. But
Yeah.
I think so many women think it's just about hot flashes and they'll just get over the hump like they get over the flu. But the
Yes.
vagina just keeps becoming more atrophic and the tissue gets thin, and then you just avoid intercourse and it becomes this vicious circle where then you look back and you're like, it's been years since I've been intimate with my partner.
Yes. And it's heartbreaking. It's a heartbreaking situation because it has a ripple effect. You feel lonely in your own home, in your own relationship. And that emptiness and that lack of connection then has an effect on your everyday life and how you interact with your children. The children notice that mommy and daddy aren't happy. They recognize that mommy and mommy aren't happy, because that happens too. It doesn't matter what kind of a relationship you're in. When you're not desiring intimacy and it's uncomfortable, there's a complete breakdown of the whole relationship, and again, ripple effect. You don't go into work feeling as happy and confident. You don't present yourself to the world in a confident manner. So intimacy is absolutely integral to our overall well-being.
Yeah, I love that you address that, because it's not just about feeling good and having orgasms, is it's about truly connecting with your partner and all of the health benefits that do that, or that go
Mm-hmm.
along with that. A couple weeks ago this summer, my oldest daughter said, my friends actually said something like, they think it's weird that you and dad are like cuddling on the couch and holding hands and going on dates. And like my friends' parents don't do that. And that just struck me as like, oh, like that makes me sad. Like, but anyway, having a good,
Absolutely. I agree. And I think that the fact that they noticed is
yes.
such a statement for the other women and families to hear. This is exactly my point about the ripple effect. Your kids know. Their
Yeah.
friends know.
Yeah. Yeah, I thought that was interesting, is that
Yes.
their friends noticed. And, it's nothing much. It's, we're not making out on the couch while my kids' friends are along. We're just sitting watching TV and possibly sitting next to each other and holding hands. And
Yes.
so,
It's an obvious connection. That's the point. So my second book is called Ultimate Connection, which I've just published, I guess, in November or so. And it's just more on this particular topic because it's so critical, so critical.
yeah, well, thank you so much for taking the time. Where can people find you, and where can people also find your book?
Well, this particular book that we have discussed is, you can buy it on Amazon if you want a paperback, but you can download it for free if you'd like at www.ultimateintimacy.net. And that would be the Ultimate Intimacy book. I'm just so desperate to get that word out. I just want women to be aware. So I'm happy to share that as
Oh,
an
even
ebook and as a
even better.
download.
Even better.
Yeah.
So,
And my website is www.drcarolyndelucia.com. Simple as that. They can find me on Instagram as Dr. Carolyn DeLucia. And I guess that's about it.
well, thank you so much for taking the time before office hours start and we start our day seeing patients. I really appreciate it. And I think our listeners are going to appreciate this valuable information.
Thank you so much, Amy. And I'm so proud that you're doing this. I can't wait to listen to every episode.
Yeah, I'll send you the link. Have a great day.
Thank you. You too. Bye-bye.
Bye-bye.
Thank you for listening to this episode of HealthiHer. You can find us on Instagram, Facebook, and the web. Go to www.dramybrenner.com to learn more. This podcast is for general information only and does not constitute as medical advice, the practice of medicine, nursing, or other healthcare services. No patient-physician relationship is formed. The information in the podcast and any references, material, or links are at the sole discretion of the listener and not meant to be a substitute for professional medical advice, diagnosis, or treatment. Listeners should not delay or disregard obtaining medical advice for any medical issues or diagnoses that they may have, and should seek medical advice from their healthcare provider for any such conditions.